Welcome back, YouTubers, to my channel of an everyday life of an Aspie. If you're new to my channel, I welcome you all. I'm all about creating mental health and awareness and sharing my life stories with suspicious syndrome and the like, be it your general health and versus your mental health, of your tips and advice along the way, with hopefully some fun and games. So this one's going to be all about the Autism Out and About series that I've been bringing out at the moment with this Autism and series. And if you haven't been following me, I've been talking about the autism and hygiene, autism and sex education, and autism and the hairdressers. So this one's going to be broken down into a bit more of this out and about, be it, you know, the dentist versus your doctors, hopefully for educating you all, and hopefully in saying this that it'll be some useful tool for you all based on whatever it is that you're looking for. So as we know, basically I'm going to be doing this one based on visiting the dentist for people on the autism spectrum, so please bear with me. And in saying this, that, you know, I want to cover some of the possible reasons that's to why the child may be disliking the experience versus hopefully some possible solutions in this. And also in saying this is just based on my experiences and knowledge of what I know of right now based on some of the research. So I'm no medical doctor, I'm just your normal everyday Joe blog. So if you see anything unfamiliar, seek professional help for yourself or your loved one, or seek an opinion for yourself or your loved one, for if I don't condone self-harm. So let's begin this. As we are really aware, for anything that goes on while we're transitioning from child to adult on the spectrum, sometimes it can be really stressful, very worrying for most of us, because obviously, you know, we dreaded most of what's to come, regardless what it may be. You know, a classic example here obviously is no other like the one I'm talking about, going to the dentist. Obviously this can be a stressful experience for most of the people on the autism spectrum as well as the carer. I am here today hopefully with some strategies to help you along the way to make the experience better for you and the child. So let's begin this. There is possible reasonings to why the child may dislike the experience of going to the dentist, and here are a few that I have listed. 1. Lack of understanding. Some people won't forever understand the purpose of going to see someone who looks into their mouth and uses certain strange equipment in their mouth, even though the child may be really super sensitive to the touch. Whilst they are expected to lie on a chair with a large light shining on their face. So you've got the light shining in the face also, that will show that they're hypersensitive to maybe the lights around on them as well. Then I might have understood the importance of having healthy teeth and gums and the consequences of not having these everyday regular appointments. 2. Sensory issues. I've just mentioned a couple in the very first one as the example. One of the main anxiety triggers, however, relates to these everyday sensory experiences. Mouths are extremely sensitive, as I shared, and for an autistic person, however, the sensation of a cold instrument of some kind prodding around in their teeth and that can be very painful. In addition to all that, the noise of drills and cleaning instruments could also pose a problem. Sometimes the taste of the mouthwash or the paste being used will also have an effect or an adverse impact on the child. There may be other sensory factors that could or may cause distress for you child, such as the dentist's perfume, moustache, or the colour of their clothing. Invasion of space is number 3. Dentists are one of the many few professionals who we allow to enter our personal space, right? Most people find this really uncomfortable, but understands that the dentist needs to be close and observe in order to examine the teeth. For autistic people, however, this close proximity may be extremely distressing. So here are some strategies to help. The following strategies here on the video that I'm about to bring out to you are dependent on the person's level of understanding and their individual needs, and should be adapted accordingly to theirs. So preparation. As a result of maybe a past negative experience, many carers will understandably try to avoid telling the person about their dental visit until the last minute or on the day of the appointment. But even though it may initially cause a behaviour pattern change, it's better in most situations to try and inform the person as early as possible so that you and the child will be ready, so to speak. This can be difficult if their concept of time is poor. So therefore maybe a use of visual supports will be in place, be it a calendar, an app on the phone, a visual one showing, you know, the day-to-day task, routine, or what have you, sort of thing, showing maybe by pictures, you know, a time slot of, you know, after brushing their teeth or something, there'll be a time slot in the diary or calendar showing, you know, dentist. If it's the person's first visit to the dentist, however, you may like to take them to visit the building, to meet the dentist and other staff before any treatment. So if the dentist is willing to actually allow you to do a little quick visit tour before leading up to that appointment slot that you have for the child, hopefully they'll just do that so they can have the feel. You may also like to show them the everyday equipment that is used, which the dentist will use and how it will work. It's also important to prepare the dentist and their team by giving them as much information as possible about the person's needs so they can make, hopefully, adjustments to the everyday procedures that needs to be done. Try to ensure that the appointment is the first of the day, may even book a double time if need be for the time slot. This may reduce the chance of the dentist running late and provides enough time not to feel too rushed. For a child with autism, visiting the dentist could be one of the scariest things possible for them to go through. Most people are scared of the dentist anyways, and it evokes a sense of claustrophobia and not being able to see what exactly the dentist is doing or getting up to in our mouths. For a child with autism, this close quarter setting and constant prodding in the mouth can be an absolute no-no or stay out of bounds area. Autistic children have a dentist for autism difficult time communicating and often at times can appear to be distant or simply detached from their surroundings or people around them. They also have a tougher time to react to social cues with unpredictable bodily movements. This is what complicates a visit to the dentist and why formulating a plan is really important and crucial. It's vital that there's a build up to the dentist visit so that they would have an inkling to know what to expect and maybe how to behave. This could be in the form of fun visual aids to explain the process step by step, if you know what's going on with the child here, say, for this process. It can also be done with a fun story time to explain a dental visit to your child. This should cover what will happen and why exactly they need to go to the dentist. Some kids may require a more intensive routine of physical aid. This is how exactly what will happen at the dentist's office. The following can be tried at home, and if you would like to take it a step further, then the basic instruments and a torch can be bought from a local pharmacy to help with the demonstration for you and the child. Have the child sit on a reclining chair and get familiar with this position. Place hands on the stomach and put feet straight out just like you would in the dentist chair. Have them open their mouth as wide as they can and hold this for a bit. Run over their teeth with an electric brush so that they can get familiar with the deep, clean polish that's given during normal everyday checkups and become used to having a strange device in their mouth. Practice the taking of x-rays and being seated very still for a few seconds. Dentist for autism, basically. Mimic spitting into a sink. Children with autism need to be acquainted with the dentist also. This could be just a meet and greet appointment where our dentist will chat up the little patient and get to know each other a bit before they do the job. The actual appointment can be scheduled for another day so that the child will not feel too overwhelmed. The initial encounter with our dentist for an autistic child can be by bringing along a friend or family member so that there's a support structure in place. Repetitive behaviours is common among autistic children, as I said so many times before. Use this to prepare them for their turn in the chair. Bring along another child, be it a sibling, cousin or friend, and let them have their consult first. This will allow the child, hopefully, with autism to watch the dentist perform their duties on them and have a further bit of understanding of what they are about to encounter themselves. Choosing a dentist for autism. It's so important to note here to choose the right dentist for autism. All of the dentists should be family dental care, should go the extra mile in treating patients with autism. We understand that it's not always easy to just go in and out for a consultation, and they should be able to provide the most seamless experience as much as possible and necessary. A parent can accompany their autistic child into the dental room. This will provide a safer blanket of sorts. Knowing that there's someone there that the child knows right there at all times, they know that their child is in a good mood and in good hands. The dentist is also should be available for emergency appointments. If you do not know in advance, of course, for this to not be in a total shock to the child, they need to already be familiar with the dentist. The dentist for an autistic child that you choose must be able to accommodate to their specific needs, such as not allow for a long wait time in the waiting rooms, etc., etc. Our dentist will the dentist will require as much back information as possible. This will include a severity of the autism, non-dislikes, and also past medical information. Many children with autism are prone to seizures. Then the dentist for autistic child is aware of this and should be well trained to respond as quickly in the event of a seizure and remove all dental items from the mouth. Social stories. Social stories, as I said before, are an effective way of providing information about an activity of any kind, be it like a classic example, as I said before, visiting a doctor or the hairdressers, about an activity and to the reasoning why they're doing it. Example, what happens at the dentist and why we need to go for a checkup. Storybooks. There are a lot of basic storybooks out there about visiting the dentist, which may help you. Example, I know why I brush my teeth. Topsy and Tim go to the dentist. Sensitive Sam visits the dentist. 3. Breaking down the visit. As I said before, you could use visual support aids such as a sequence of pictures or photos that show the different steps and stages involved in the dentist visit. This could help the person to know which is coming next. Each step is finished. You could also include a reward picture at the end of the sequence so that having something to look forward to is a key calming relaxation factor. Time indicators. Use visual auditory timers, e.g. sound timers, buzzers, or a mobile phone alarm to help the person to understand that this experience has a time limit. Comfortable distractors. Letting the person take comfort into the dentist's surgery could help to occupy or distract them. For some people, listening to music on headphones or having music in the background can act as a real good blocker. Sedation. For some people, the experience of visiting the dentist is so distressing that it may be necessary to consider sedating. If you feel this is the case, you will need to talk to your dentist and a medical professional to discuss the options. Finding a dentist. Your local clinical commissioning group or health board should be able to help you to find the right dentist with the experience of working with people who have the additional needs with autism. So this quickly ends a quick video of autism out and about visiting a dentist. Smash the like, comment below. Feel free to follow me on my social media sites. Feel free, as I said before, to subscribe if you want to join me on the bandwagon to get to know me more and what I get up to with my life as an Aspie by subscribing. Feel free to turn on the notification bell so you can keep up to date with my regular content. Feel free to share these videos around to family and friends because, like I said, these should be hopefully informed and hopefully get people thinking. So enough for the do, guys. Thanks for your support, thanks for watching. Do what I love what you do. Until next time, Aspie signing out, and I'll see you again soon. Ciao for now.